Remember that we have a continuous masking directive in place in AHS, where all staff, physicians, and volunteers are expected to be masked continuously while in patient care areas and in any workplace areas where they cannot maintain 6 feet or 2 meter physical distancing between your colleagues. Remember, wearing is caring. My mask protects you. Your mask protects me. We've been getting a lot of questions about the masking of patients and whether patients in their care rooms or in other spaces should be expected to mask. And so today, we'll try to address some of the questions we've received about patient masking. There is an expectation that inpatients in AHS facilities should mask when they're leaving their inpatient rooms and moving to another part of the facility. Of course, the mask needs to cover both the nose and the mouth. Now, we've been asked, should patients be expected to mask inside their care space, their inpatient rooms? This has been addressed by a couple of different groups, and we do not think that patients should be asked or required to mask when they're in their own care room in acute care facilities. Patients, of course, are in hospital because they're ill, and we think it's unfair, it's unreasonable to ask them to mask continuously in their room. If they were to put a mask on and off, of course, that requires hand hygiene before putting the mask on and after taking it off, and that may be difficult for patients in an acute care room. But most importantly, continuous masking by staff, sometimes supplemented by other personal protective equipment, protects staff. We know that this equipment effectively protects our staff, and therefore it is not necessary for patients to be masked. What about masking of patients in the outpatient setting or the emergency or urgent care setting? Patients should be offered hand hygiene and a mask, and they should be asked to don it. Importantly, no patient should be denied service because they cannot or will not mask. If they will not accept a mask, they can be offered a face shield and then moved to a care area, a private care space, as quickly as is reasonable. Again, if they decline the mask, they could be offered a face shield. We should assume that patients who have not provided a complete history might have COVID-19, and again, we should escort them to a private care space, and our staff should use contact and droplet precautions until we are able to get a complete history and assess risk factors for COVID-19. Asymptomatic patients without any risk factors can leave that room or care space as long as they either don a mask or a face shield. However, symptomatic patients or those who have significant risk factors for COVID-19 should not leave that care space without a mask unless there is an emergency situation that requires them to leave that space. On discharge, we should try to encourage individuals to leave our facilities via a route that exposes them to the least number of people possible. We know that difficult situations can arise. We hope that they will be infrequent, but if they do, we urge you to call on other staff to help, or if needed, call on protective services. Remember our values of compassion and respect, and these should help guide us through some of the difficult situations. But again, call on your coworkers and protective services should you need assistance. Remember, wearing is caring. My mask protects you, and your mask protects me.
Together, we do amazing things every day.